After admission to hospital. When you go onto the clinical care unit, your personal belongings will remain on the ward. All your relatives can take them home for safekeeping. Your toiletry bag will be labelled with your details, and this will then be sent up to you in the critical care unit. Therefore, it's important to put them in a small separate bag to your other belongings. This can be in a toiletry bag or a plastic bag. There is very little space on the wards to store suitcases or clothes, and your property may be packed away whilst you are in the critical care unit. In order to minimise the risk of loss or damage, it is in your best interest to only bring in what you will require for your stay. Jewellery and money. A small amount of money can be brought into hospital. However, we would advise that valuable jewellery or large amounts of money be kept at home. Any jewellery, including wedding rings, will need to be removed before your operation, so please leave these at home. If it is necessary for money or valuables to be brought into the hospital with you, we would advise you to discuss the safe storage of your valuables with the nursing staff. Please note that the Trust cannot be liable for any loss of personal belongings during your stay with us. Admission to hospital. We believe that relatives or carers should be involved in your care and treatment whenever possible. If you're in agreement with this, it is particularly important to let us know if you have a specific requirement or a disability in order for us to provide you with extra support. If you have any special needs, we may need to complete a document called a hospital passport, which will detail all your requirements, and this document will accompany you during your stay. We will hopefully have been informed of your needs before your admission, so that any arrangements for extra support can be put in place. If we have not been informed, please let us know as soon as possible. Also, if English is not your first language, or if you have any religious requirements, please let us know and we will do all we can to help. Single-sex accommodation. Although our wards cater for both male and female patients, whenever possible you will be nursed in a single-sex bay and have access to single-sex bathing facilities. Some areas such as the critical care unit and the day ward may not be able to do this, but the nursing staff will ensure that your privacy is maintained at all times. If you're concerned about your privacy and dignity, please talk to a member of staff. Arrival on the ward. Some of the tests you had at the pre-op clinic may be repeated. Do not be alarmed at this. Some are done as a matter of routine, like your urine test and your weight. Some may have to be repeated to check that any abnormalities have been corrected. The reasons will be explained to you, but if you're still concerned, just ask. The staff you may meet will include the ward manager. It's available to you and your family during your stay in hospital. If you have any problems or queries during your stay, the ward manager will be happy to discuss these with you. Nursing staff will show you around the ward and help you to settle in. The nurse will spend some time with you after admission, finding out how you are and explaining to you more about your stay in the Liverpool Heart and Chest Hospital. It's important that you share any concerns or issues with the nurses. A doctor-surgeon may examine you and ask you questions about your illness. They will explain the operation to you and ask you to sign a consent form if you have not already done this with your surgeon in the outpatients department. Your consent form indicates that you agree to the operation and that you have fully understood what will be involved, so make sure that you have discussed it fully with the doctor. An anaesthetist. Is the doctor responsible for your anaesthetic? They will ask you questions about your medical history, the symptoms your heart disease gives you, allergies and the drugs you are taking. Please refer to the section on Anaesthesia for cardiac surgery for further information. The pain control specialist nurse is a senior nurse with experience of giving advice and support to staff, patients and their relatives on the management of pain following surgery. She works closely with the staff, caring for you to achieve effective pain management during your hospital stay. A physiotherapist will teach you appropriate deep breathing and coughing exercises after your operation. These exercises will allow your lungs to re-expand and help reduce the risk of chest infections occurring. The diabetes nurse specialist is a senior nurse with experience of giving advice and support to patients on management of their diabetes during their stay. A tissue viability nurse specialist is a senior nurse with in-depth training in wound care and pressure ulcers, otherwise known as bed sores. She will be available to support any patient who requires management of these conditions during the hospital stay. Matron. The matron is a senior nurse in charge of a group of wards and can deal with a problem if the ward staff are unable to do so. Other staff involved in your care. There are many other members of staff you may meet during your stay. However, all will be wearing identification badges. Radiographers, physiotherapists, ECG technicians, pharmacists, laboratory staff and domestics, porters, medical secretaries, ward clerks and dietitians, to name but a few. All staff will introduce themselves. Medical students and other healthcare professionals cannot learn all they need to know from textbooks and lectures. During the period of your treatment, you may be asked to consent to having students present or taking part in your examination or treatment. Under the guidance of a qualified person, you have the right to refuse without affecting your standard of care to you in any way. Your cooperation in helping students may benefit other patients. Before your operation, anaesthesia for cardiac surgery. This section is to give you a brief overview of what to expect from anaesthesia and the anaesthetist. Each individual operation and an anaesthetic is tailored to the individual patient. For your operation, your anaesthetist will visit you on the ward. He or she will ask various questions concerning past anaesthetics, your general health, and specifically questions concerning the symptoms of your heart disease. This is also the opportunity to discuss your care after the operation in the critical care unit and methods of pain relief after surgery. On the night before and the morning of your surgery, the anaesthetist is likely to alter some of the drugs that you normally take, removing some and adding others. The anaesthetist is also likely to offer a sleeping tablet the night before surgery. Although this is not compulsory, most patients prefer to have a good night's sleep before their operation. On the day of surgery, normally patients are not allowed to eat or drink from midnight, although in individual circumstances this may be altered by your anaesthetist. If in doubt, ask. The reason for this starvation is to prevent the contents of your stomach going into your lungs after you are anaesthetised. Approximately 2 hours before your surgery, you will receive a pre-medication tablet or tablets. These are designed to make you a little drowsy and decrease any anxiety you may experience. You will be transferred from the ward to the operating theatre in your ward bed. After arriving in the operating theatre, you will be asked once again to check your name and date of birth and what operation you are expecting to have. This is an important final check to ensure that we have the right patient for the right operation. Before going to sleep, you will have a drip, a small plastic tube, inserted into a vein and an artery, but your anaesthetist will use local anaesthetic to reduce as much as possible any discomfort you may feel. After attachment of ECG stickers, the anaesthetist will ask you to breathe some oxygen from a face mask. If you are claustrophobic, mention this to your anaesthetist when they see you on the ward, and methods of getting around this problem will be discussed. Anaesthetic drugs will then be injected into the drip, and you will slowly drift off to sleep. Your anaesthetist will stay with you throughout the operation and accompany you and settle you into the critical care unit. At the end of the operation, the anaesthetist is responsible not only for keeping you asleep, but also for controlling your blood pressure, heart rate, lung function, kidney function, temperature control, and blood volume during the operation. Apart from actually performing the operation, the anaesthetist is responsible for looking after just about every other aspect of your care. Showering. It will be necessary for you to have a shower the night before and immediately prior to your operation. The nursing staff will also advise you when the best time for you to do this is. They will also help provide you with the use of antiseptic skin wash. This will help to prevent any infection occurring in your wounds. If you need assistance when showering, please inform the nursing staff. Hair removal. Before the operation, it will be necessary to remove hair from around the operation sites. The nurses on the ward will tell you how to do this and assist you if necessary. Please do not do this yourself at home, as shaving increases the risk of infection. If you shave too early, you may cut yourself, which can be another source of infection. Pre-medication. Before your operation, your pre-medication will be given to you. This is given to help reduce or relieve anxiety and is usually in the form of tablets. The pre-medication can make you very drowsy. Therefore, once you've taken it, you must stay in bed and call a nurse if you need anything. Prior to be given your pre-med, your nurse will go through a checklist with you. This has lots of questions, which you will be asked again once you have arrived in theatre. You will be asked the same questions a number of times. These questions are designed as a safety measure for your protection. A ward nurse will accompany you to the theatre and will stay with you until you are introduced to the operating department staff. Theatre. Once in theatre, you will have sticky pads attached to your chest so that your heart rate and rhythm can be monitored during your operation. You will also have a drip put into your vein and another into an artery in either your wrist or your groin. This can be uncomfortable, so the anaesthetist will give you local anaesthetic beforehand. You will then be asked to breathe in some oxygen through a mask until you go to sleep.